Good morning. I'm Steve Greenstein, CEO of CaregiverWatch. We are a pre-revenue company that will be manufacturing in-home nighttime monitoring devices for individuals with cognitive impairment and their caregivers. Our solution has been supported through National Institutes of Health clinical trials in which we have over 350 cumulative months of in-home study in which we saw an 86% reduction in nighttime events. Our technology is patent pending with an exclusive license out of the University of Florida, and we're looking for a mid-2012 commercial launch. As you look at the problem, individuals with cognitive impairment, and what we're talking about here is autism, Alzheimer's, they have a propensity at nighttime to awaken frequently. And when they do, they're at risk for two issues. One is injuries due to falls, and the second is unattended home exits. The flip side to that is the caregivers, in which they're experiencing tremendous stress and strain related to these nighttime events. When you speak to these caregivers, one of the first things that they tell you about is how they have to learn to sleep with one eye and one ear open, such that they feel comfortable in being able to hear if in fact their loved one gets up and they can attend to them quickly. So with that, we've produced Alls Alert. This is our solution. Alls Alert is an in-home nighttime monitoring system that's supported by a master control panel, which typically will be sitting by the caregiver's bedside. This is where the alerts and programming takes place. Supporting that will be a bed sensor, which will sit in between the box spring and mattress of the care receiver. We then have activity sensors that will strategically place throughout the home. Now, what makes us different and makes us so special is that the system is based upon filtered activities, parameters, and thresholds that the caregivers establish that are based upon activities, based upon location, and based upon timings. So when the care receiver is in bed at nighttime, the occupants are free to move around the house without setting off the master control panel activity. When that care receiver, though, gets up out of bed, that's when the system comes alive. And the system will report upon those activities based upon the thresholds and parameters that have been established by the caregiver. So if the activity is within the established thresholds and parameters, the reports will be informational and alert-based. However, if those actions and activities exceed those parameters and those thresholds, the type of alerts will be more emergency in nature, directing that caregiver to the specific location within the home. Some other unique perspectives and system of our system. Number one, there's no transmitter that needs to be worn by the care receiver. Nothing for them to wear. No pendants, bracelets, watches. Our system comes out of the box working. All the sensors are pre-programmed. There is no hard wiring involved. And there's no third-party monitoring. The system is completely self-contained. There is no need for internet coverage, phone line coverage. The system will report out on the activity as well as any diagnostic issues that are required. As you look at the market, there's over 5.5 million individuals with Alzheimer's. 1 in 8 over 65. Here in Florida alone, there's 500,000 individuals with Alzheimer's. There are new cases being diagnosed every year in excess of 500,000. When we look at the autism market, there's 750,000 children under 21 with autism. 1 in 110 children are being diagnosed each year. When we look at the caregivers, what we're talking about here is the non-paid, the relative caregivers, the husband, the wife, the son, the daughter. There's over 15 million of those. There was a recent Parks Associates study done that indicated these people, 40% of them are looking for in-home monitoring solutions to help with their caregiving requirements and needs. We spoke about the stress. Caregivers spend over $4.5 billion a year on their own health-related medical expenses due to the stress associated with caregiving. And it's not a short-term duration. 75% will provide caregiving support in excess of a year, 32% in excess of 5 years. As we look at the market and the landscape, the competitive landscape, the reality is we are the only one who has a targeted solution towards this nighttime in-home support. There's other products you may be aware of, PERS devices, the fall and I can't get up. Those are directed towards individuals who still have the cognitive ability. They know how to push a button if there's an issue. There's other devices you may be aware of, GPS type devices. Those devices come into play when the individual has already left the home. They're in a community, and as long as they're wearing a transmitting device, they're used to be located. Our solution helps keep these people in the home so they don't get lost in the community. As you look at our sales and distribution strategy, the retail price point will be $1,299 at launch. We have a contract manufacturer lined up, and with a system costing about $550. From a distribution perspective, we're going to be leveraging non-stocking regional and national distributors that are familiar within the home healthcare services and product arena. Additionally, we will also engage with online affiliate marketing, tagging along to web pages that are dealing with caregiving issues. Trade shows, as well as our own online presence, will support our launch and first few years. As we cut our teeth, as we get better and smarter, that's when we'll begin to introduce national distributors, tier 1 distributors, Philips, ADT, GE, Intel. And then finally, something we're very excited about, and that's financing. I've been able to secure an arrangement with a national consumer financing company. Typically, they don't support companies until they've got a 2-year track record of their product. They're so excited about our product, they are willing to support us day one with a financing option. What this means is that consumers will be able to get into this device less than $100 a month. As we look at our 5-year projections, this is all about distribution. And as I talked about our distribution approach, goal is to start mid-2012, ramp, it'll be regional, we'll develop those relationships, and continue to grow our distribution channels in support of our unit sales. In terms of the management team, this is something we're very proud of because it is a complementary set. My background, I've got over 20 years worth of sales operations and distribution experience, companies such as AT&T and Radio Shack. Dr. Meredith Rowe, who is the inventor of the product, a practicing PhD nurse researcher. Her passion is in developing solutions targeted towards the caregivers of individuals with cognitive impairment. And Jerry Bielert. Jerry also has over 20 years worth of sales distribution expertise, focusing on sales channel development and management. As we look at our investment requirements, overall we have a $1.6 million ask. We've got it broken out into 2 tranches. The first is the pre-launch support infrastructure build, and the second is our launch support. And then specific to the use of the ID grant, we will target our funds, the funds that we receive, for the development of 80 units, which in fact will be sold to the National Institutes of Health. We've secured a secondary grant for the use of these units in another test on how caregiving supports cardiac issues. So they'll be purchasing 80 units from us. So we'll produce the 80 units as well as the tooling that will go into the Go Forward commercial build. So we will have a clear line and path to manufacturing come 2012. I want to thank you and open up to questions and answers.